Dear audience, welcome to my 3-month progress report, where I present my projects that help strengthen the relationship of acute pancreatitis with cancer. My name is Jimin Lee, and I'm currently a 6th-year medical student at Semmelweis University, and I'm enrolled in the MD-PhD program with the Center for Translational Medicine, where my vision is to improve the prognosis of pancreatic cancer. And to achieve this, my mission is to prevent the progression of pancreatic cancer into its later stages by determining its early predictors. So currently I have 2 ongoing projects. My first project, I want to strengthen the relationship of acute pancreatitis with pancreatic cancer through a systematic review and meta-analysis. My second project, I want to determine the prevalence of malignant tumors in those with acute pancreatitis through a registry analysis. So my first project is to investigate the effect of acute pancreatitis to the development of pancreatic cancer. Despite the advances in medical technology, pancreatic cancer continues to be a deadly force within the medical field, where it is predicted to be the second leading cause of cancer-related mortality by 2030. Pancreatic cancer is known for its asymptomatic nature, making it difficult to make an early diagnosis and often discovered in its later stages. Less than 20% of pancreatic cancer patients are eligible for resection at the time of diagnosis, resulting in a much poorer outcome. Therefore, there is a need to clarify various predictors of pancreatic cancer in order to determine and detect the pancreatic cancer in its earlier phases. Acute pancreatitis, which is the most common cause for inpatient gastrointestinal hospitalization, can serve as a possible predictor. It has been associated with pancreatic cancer, but the exact relationship continues to remain unclear. So with this in mind, I would like to investigate if acute pancreatitis is associated with a higher risk of pancreatic cancer. So to investigate this issue, I formulated the following question: does acute pancreatitis increase the risk of pancreatic cancer? Here we want to analyze the general population and compare those with acute pancreatitis to those without acute pancreatitis and assess the incidence of pancreatic cancer in each group. And we believe that acute pancreatitis will increase the risk of the development of pancreatic cancer. And in the clinical setting, if the lifetime risk of pancreatic cancer is known in the acute pancreatitis patients, then we can do an adequate follow-up strategy so we can detect pancreatic cancer in its earlier stages where the outcome is more favorable. If there's enough data, we would also like to do a sub-analysis answering the following question: what are the risk factors for pancreatic cancer in patients with acute pancreatitis? Here we want to assess the risk factors for pancreatic cancer in patients with acute pancreatitis and see if they have an effect on the development of pancreatic cancer. And we believe that certain risk factors will augment the development of pancreatic cancer. And in a clinical setting, if we can identify these risk factors, we can also identify the subpopulation who is at risk for pancreatic cancer. So we can do the adequate follow-up strategy in these patients in order to detect pancreatic cancer in its earlier phases. We conducted a systematic search on October 11, 2023 on 3 different online databases, and we had a total of 32,313 articles. We used a search key with 2 different domains. The first domain described the acute pancreatitis, while the second domain described the pancreatic cancer. Here's the flowchart of the selection process, where we started out with 32,313 articles and narrowed it down to 25,000 articles after duplicate removal. I divided this number of articles into 3 different groups for my 3 different co-investigators. Here's the current progress of my first project, and we are currently in the title and abstract selection, where we're selecting the articles based on the title and abstract and their relevance to my topic. And as you can see on the slide is the progress of each of my members in my study. So for my second project, I want to investigate the prevalence of pre-existing malignant tumors in patients with acute pancreatitis. After discharge, the first-year mortality rate in acute pancreatitis patient was almost double compared to the in-hospital mortality, with age, comorbidities, and acute pancreatitis severity being the most common and significant risk factors for death following acute pancreatitis. It was also found that the acute pancreatitis-related mortality rate was 9 times higher in patients who are older than 60 years of age. So this poses the question: is it due to aging itself or due to other comorbidities that come with age? One of the possible comorbidities that came up was cancer-related cachexia, which brings us to the aim of the study: to investigate the prevalence of malignant tumors in acute pancreatitis patients. So with this being a registry analysis, we will be able to evaluate several variables. So we constructed 2 different clinical questions. And the first clinical question we want to answer is acute pancreatitis associated with a high prevalence of malignant tumors? Here we want to assess the prevalence of pre-existing malignant tumors in the adult population with acute pancreatitis. And we believe that acute pancreatitis is associated with a high prevalence of malignant tumors. And in a clinical setting, if a patient comes into the clinic with acute pancreatitis, then we can have increased awareness that this patient might have a pre-existing malignancy as well. So for my second clinical question, we divide into 2 parts. For the first part, I want to assess is what is the prognosis of patients with acute pancreatitis with the malignant tumors. Here we want to analyze the patients with acute pancreatitis and compare those patients with pre-existing malignant tumors to those free of cancer. And we want to assess the prognosis in each patient group, such as hospital mortality, length of hospital stay, and ICU admission. We believe that pre-existing malignant tumors are the risk factors for severity and mortality in patients with acute pancreatitis. And in a clinical setting, we can closely monitor these acute pancreatitis patients for the early identification of the associated malignancies, as well as treat any possible complications that may come with it as well. For the second part of my clinical question, we want to assess what are the risk factors in acute pancreatitis patients for having pre-existing malignant tumors. Here we want to assess and analyze the demographics, comorbidities, and etiology, and among others, in acute pancreatitis patients and see if they have an effect of the patient of having a pre-existing malignant tumor. And we believe that the subpopulation of acute pancreatitis patients are at higher risk for having a pre-existing malignant tumor. And in the clinical settings, if we can identify the subpopulation, we can also identify the risk if we can identify the risk factors, we can identify the subpopulation and do an adequate follow-up strategy in these patients. So the registry that we'll be analyzing will be an AP registry that was launched by HPSG Group in 2012. It has currently at 27 uploading centers in Hungary with 4,884 cases, but this number of cases might change depending on the data available and also my eligibility criteria. So blood samples and patient data were prospectively and reliably collected with two different forms. The first form is the Form A, which was the data collected upon the admission, and the second form is Form B, which was the data collected during the follow-up period. So in summary, my two studies will focus on increasing and strengthening the relationship of acute pancreatitis with cancer. For my first project, I want to submit it and have it ready by June 2024, and my second project, December 2024. So to end, I would like to quote Marie Curie: "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less. Cancer is a terrifying disease because its nature is poorly understood. With my studies, I hope to better understand the nature of cancer through the association with acute pancreatitis so that we may fear it less." Thank you for your attention.
Thank you very much, Jimin. Very nice presentation. If you may comment a bit, or can you elaborate a little bit about the first project? There will be two types of information available in the literature because we know that pancreatic cancer can cause acute pancreatitis. However, we don't know so much about the effect of AP on pancreatic cancer development. What kind of data is available out there? What kind of studies do you expect to find and to include in your analysis to evaluate this question?
Thank you for your question. So currently I have 3 key articles that have a acute pancreatitis cohort, and they do a follow-up period of so many years, and they assess when the pancreatic cancer appears in each patient. And so some studies have like 10-year follow-up, 16-year follow-up, or even 2-year follow-up. And from these key articles, one key article stated that with the highest incidence within the 2-year period, but another key article stated that it was highest incidence in this 2-month period. So there's some conflicting data, but we have some data that will help solidify the relationship.
Do you plan to differentiate the pancreatic head and the pancreatic tail tumors? Because with this respect, they are totally different.
We have not discussed the difference in differentiating them. We only included all the pancreatic cancers. So for this stage, we have not considered them, but yeah.
I'd like to ask that your opinion that after pancreatitis, when we have to wait the appearance of the pancreatic cancer? When?
Well,
based on the literature.
Based on the literature, there's not much information about the exact pathophysiology of why acute pancreatitis might cause pancreatic cancer. But from what I've read and what I've understood is that they've thought that acute pancreatitis severity is the more significant factor, because we know that chronic pancreatitis can cause pancreatic cancer because the repeated inflammation will cause a damage to the cell and also the genetic material causing mutation. So I believe that if there's a higher severity of acute pancreatitis, then it can cause irreversible damage on the cells and the genetic material, which can cause the mutations and further carcinogenesis.
Isn't the other way around? Because there is a tiny little cancer and it obstructs the pancreatic duct. We have not diagnosed, and it takes quite a long time, and then it turns out that it is cancer. So, how long does it take to develop a detectable size of pancreatic cancer?
So pancreatic cancer, as I mentioned, has a very asymptomatic nature, so it's difficult to figure out when it exactly starts. So I have not found many articles concerning that, when they found exactly when it starts, but often discovered when it's later stages, when it's become more deadly and untreatable. So I'm not sure.